Hi, I'm Stephanie, and with Nicole, we are an OT PT duo to help PTs, OTs, assistants, and students with activity ideas and the documentation. So, today we want to talk about an activity we can do to help our patients get out of a car, or to get out of the tub, or how about to get out of a booth at a restaurant? Some of these things we just overlook, and our patients really want to get back to it. So, what do we need to do? If they can't lift their leg up and over to get out of these things, we need to work on hip mobility and hip strengthening. So, one of the activities that we can start with is we can start in sitting. We have these Note Ninja gliders. We have them. You can get them at Target, on Amazon. One side just can go on the floor, and the other side is if you're on a rug. So, and they glide nicely. So I would have my patient's foot on the glider and I would just do hip circles back and forth. It actually feels really good too on the hips, get some mobility going, really help them be able to get their leg in and out of the tub, in and out of the booth, in and out of the car. And then make sure you are cueing them. Maybe they're leaning sideways to really help because they don't have that mobility or that strength. You can say performed mobility to help your patient get in and out of the car with tactile cues to sit up tall and engage core. Whatever you did, you're showing now the functional activity it works on and the cues and the skill you are giving. It's a great activity to do. You could also progress this to standing. You can change it to, instead of just sliding for the mobility, make it more for strengthening. Once they have that range of motion, your patient can pick their leg up and go over and back. You can put an object that's higher, maybe one of my weights or something like that, and I can have the leg go over and back to really get that hip flexion strength and that ab and adduction, as well as the flexibility. It's all these little parts that sometimes we overlook that can really get our patient back to their functional activities. And like I said, then you just document it. Make sure you correlate it to that functional activity. That way insurance pays for it. You know you're helping your patient and you're cueing them to give your skill. So we hope this helped. Make sure to follow the Note Ninjas for more treatment ideas and documentation tips.